Hi everybody, this is Michelle from Virtual Hand Care, and today we're going to talk about carpal tunnel surgery. I'm going to show you a few simple exercises that you should be doing immediately after you've had your carpal tunnel surgery. So disclaimer though, if your doctor said he didn't want you to do any exercises, then listen to your doctor. But I've been doing this for about 15 years, and most of the time, the doctor says start moving right away. Most people think that means just moving, and they just wiggle their fingers and they just do this. Well, I'm here to tell you that wiggling is worthless. Wiggling the fingers does not help you get that full range of motion. I'm here to show you a few simple exercises that you should do right after you have your carpal tunnel surgery. And you can do these even with your dressings on. You want to make sure that you're moving those tendons through that carpal tunnel surgery space. So what you do is come right below the tip of the index finger, and you want to do that one about 10 times. And you want to do these for each of your fingers. That move the tip of the finger. So the tendons that move the tips of the fingers, and then the next joint, this is called your FDS or your flexor digitorum superficialis. Those go through your carpal tunnel space as well. Now, you have 10 structures that go through the carpal tunnel space, which that is 2 of the tendons to each finger, okay? So like I said, your FDP and your FDS, but it's to each of those fingers. So 2, 4, 6, 8, and then you want to move the tip of the thumb, which makes 9. That's your FPL or your flexor pollicis longus. And then the median nerve, that carpal tunnel nerve, makes the 10th structure. So there's a lot of things that go through a small tunnel. So you want to make sure that after you do the surgery, which they release that tunnel, you want to make sure that all those structures are still moving nicely and sliding through that space so that they don't get stuck in any scar tissue and swelling and potentially have some problems or stiffness after your surgery. The next exercise is going to do a blocking exercise with just the knuckles. So you're going to just try to do the knuckles and move those knuckles down into flexion. And then finally, you'll want to try to make a fist, but you don't want to make a tight fist. Just a simple, gentle fist. And then you also want to make sure that you do some simple wrist exercises. Most of the time, if you had carpal tunnel, your wrist should not be completely immobilized. Most surgeons don't immobilize you completely. They'll put a big bulky on, and they'll want you to just move gently throughout that. If that hurts too much, just make sure you're at least moving the fingers. Now, there are other exercises you can do with your carpal tunnel, but you want to just do some gentle movement right out of having surgery so that you don't get stiff, and it'll make your recovery much faster the sooner that you get your exercises going. Now, if you are looking for more exercises and what to do down the road in the next week to 2 weeks and after you have this dressing off, click on the link below, which will direct you to virtualhandcare.com, where I offer programs that you can do on your own after your surgeries, or you can also connect with me, book an appointment, and we can help tailor a program that's right for you. Like this video and subscribe to virtualhandcare.com. Thanks for watching.